Good morning. Good morning. Today we are relaunching our TPE caucus, and the agenda is as follows. It's opening and welcome. Item number 2, its purpose and overview of TPE caucus. Then we'll have messages of support by the civil society and also by the chairperson of the Portfolio Committee on Health. Then we'll have the status of TB and also combined with the address by the acting premier, which is MEC Manzini. Then we'll relaunch our TPE legislature, members of the Executive Council, executive mayors, speakers, councillors, members of SANAC and MPEC, representatives from the Department of Health, distinguished guests from civil society, academia, development partners, and the healthcare fraternity, traditional leaders, community representatives, ladies and gentlemen, good morning. It is both an honor and privilege to welcome you all to this significant occasion, the relaunch of the Tuberculosis Caucus of the Mpumalanga Provincial Legislature. Today is not merely about reviving a structure. It is about renewing our policies, treatment programs, and community awareness. TB continues to affect thousands of families. Disrupt livelihood. Our responsibility is not only to make laws and exercise oversight, but also to ensure that government programs truly respond to the lived realities of our people. The relaunch of this TPE caucus therefore reaffirms our commitment to strengthening oversight, promoting accountability, and advocating for policies and programs that can accelerate the fight against tuberculosis. Our country, under the Constitution of the Republic of South Africa, 1996, places an obligation on all spheres of government to progressively realize the right to access healthcare services. Section 27 reminds us that healthcare is not a privilege for the few, but a right for all. This caucus must therefore serve as a practical instrument to ensure that this constitutional promise becomes a lived reality in every village, township, farm, and urban center across Mpumalanga. Colleagues, tuberculosis is often deeply linked to poverty, overcrowding, unemployment, malnutrition, and inequality. Therefore, defeating TB requires more than medicine alone. It requires partnership of hope, champions of awareness, and voices for those who may suffer in silence. Let this caucus not be a symbolic structure, but a working platform that drives measurable impact in the lives of our people. To all stakeholders gathered here today, government departments, healthcare workers, researchers, civil society, organizations, traditional leaders, and development partners, your presence demonstrates that the fight against tuberculosis is a shared responsibility. Together, we can build healthier communities and a healthier province. As I conclude, let us recommit ourselves to the vision of a TB-free Mpumalanga, a province where every person has access to timely diagnosis, quality treatment, compassionate care, and the opportunity to live a healthy and productive life. It is therefore my honor to officially welcome you all to this important relaunch of the Tuberculosis Caucus. May our deliberations today inspire action, strengthen partnership, and bring lasting change to our communities. With those words, you are all welcomed. I thank you. Can we move to the next item on the agenda, which is the purpose and overview, of TB Caucus, and invite Dr. Khensani Nkwashu from SANAC to give us the purpose why we are here. Over to you, Doctor. A round of applause.
Thank you very much, Honorable Speaker. Honorable Speaker, honorable members of the Provincial Legislature, representatives from government, departments, private sector, civil society leaders, development partners, traditional and religious leaders, healthcare workers, distinguished guests, ladies and gentlemen who are here today, political structures, the nurses that are today recognized, as the backbone of the healthcare sectors or the healthcare of our people in the communities where they play a role of politicians, they play a role of mothers, they play a role of sisters. And we have seen them, being at the center of the TB response throughout the whole world. So why are we here today? What is the purpose of this TB caucus that we're talking about? The TB caucus was established to strengthen political leadership, accountability, advocacy, and oversight in the national response to tuberculosis. And it aligns with the global commitment that we as South Africans have made. The purpose of the TB caucus include strengthening political commitment and leadership on TB, promoting oversight and accountability on TB programs, and also advocating for budgets, advocating for improved TB prevention, diagnosis, treatment, and care, supporting the implementation of the National Strategic Plan for HIV, TB, and STIs that we started implementing from 2023 and will come to an end in 2028. And also addressing barriers such as stigma, inequality, poverty, and delayed access to health care. Today, I always say when I stand up that it becomes embarrassing when you stand up as a South African, when we talk about these issues of stigma and discrimination against people who are infected or who are affected by TB. And also ensuring that the voice of people affected by the TB and represented in decision-making platforms, even if they are not there. The caucus can also play an important role in mobilizing multi-sectoral and also at the same time multi-party actions, because TB is not a health issue. TB is not a health issue, but TB is a social and a structural issue that manifests itself as a health problem. So, having said that, it is also an economic, developmental, and human rights issue, because the moment we mention the issues of stigma and discrimination, we are touching on the rights of an individual that are being violated. So hence the expectation is that the TB caucus will be able to address all the issues that I've mentioned. Where are we in terms of the TB caucus in South Africa? Just going to give you a brief overview of the TB caucus in South Africa. In South Africa, the TB caucus was initially established, during the 6th administration, but preparations were started to be made during the 5th administration, and has since evolved into an important accountability and advocacy mechanism within the country TB response. The national response, or the national relaunch of the TB caucus, took place last year in October on the 25th, where the speaker relaunched the South Africa TB chapter in Parliament, reaffirming us operate in alignment with the South African National AIDS Council's National Strategic Plan for HIV, TB and STIs, with the World Health Organization and TB strategy, the United Nations Sustainable Development Goals, and the multi-sectoral accountability frameworks for TB. All of these have been translated into our different provincial implementation plans that guides us to say that in Mpumalanga, what our roadmap will look like. And I also want to highlight that Mpumalanga relaunched the TB caucus during the 6th administration, but it was done, online, virtually. It's an important milestone because we are doing it physically, in-house, and we will be able to make our commitments, in a physical environment. Why the TB caucus matters? Why are we saying that it is not a health problem, but it is our problem, all of us who are sitting here, together with our other members that are not present at this moment? Despite the progress that has been made over the years in the fight against TB, having seen that, our government have invested a lot when it comes to the TB response. And I would like also a lot when it comes to the TB response. And I would like also for the members to know to be sent to the public sector, where it is managed, by the nurses that we have acknowledged in the beginning that they are the backbone, of our healthcare. Of our healthcare. So despite all this, this progress that we have made, the TB continues to affect the poor and the vulnerable communities, the mine workers and ex-mine workers, people living with HIV, rural communities, children and young people, individuals facing barriers to healthcare access. And I just want members to note this, that with the current National Strategic Plan for HIV, TB and STIs, we have noted that in 5 years, we need 275 billion that will spend on managing TB and HIV and STIs. And noting that almost 60% of people who are infected with HIV, they are also infected with TB. So it is a huge amount of money and huge amount of resources that are channeled there. Hence, all of us, we've got a responsibility. Our politicians have a responsibility of ensuring that we bring this awareness to our communities and we all fight TB. Many people are influencing policy and funding decisions and ensuring that no community is left behind as we interact with the people in our communities. The role of the Mpumalanga Provincial Legislature when it comes to the TB caucus, briefly, has an important role to play in the national TB response. The province continues to face significant TB and HIV burdens, particularly within communities affected by migration, mining activities, poverty, and healthcare access challenges. The relaunch of this caucus creates an opportunity for the province to strengthen political coordination and also to strengthen, the multi-party structures that we have within our communities, because it is not only a burden for one party, but it is for all of us. We need to take responsibility and fight TB in our local areas. Enhance integration between HIV and TB services, support early detection and treatment adherence, promote community-led response, and mobilize all sectors behind a common vision. The work cannot be done by government alone. Hence, we also need our private partners, and we also need civil society on board. And we also need all political parties and sectors of the society. Hence, in the terms of the way forward, we must move beyond this relaunch, is to ensure that there is an establishment of a steering committee. And this steering committee, it is the one that is going to assist the legislature and the speaker in driving all the actionable plans that we are going to come up with. And it's not a one-size-fits-all. The specific challenges that are faced here in Mpumalanga, they are not the same that Limpopo faced, they are not the same that Gauteng faced. But we are going to look at our local problems, our local challenges, and we come up with our local solutions. And we are going to develop a provincial TB caucus work plan, where the expectation, in line with the guidelines from the Global TB Caucus, that it will be monitored here in this house, and it will be aligned to the National Strategic Plan, the Global South Africa TB Caucus commitment, the TB Recovery Plan, and the challenges that we face within the province. And in this work plan, briefly, it will outline our priority actions, our timelines, responsible stakeholders, and reporting mechanism of whom we would like to be held accountable. And all the efforts that we'll be working towards, they will all be channeled to be accountable to the Parliamentary TB Caucus that is chaired by the Speaker of Parliament. And from SANAC's side, being the one that provides the secretariats, hence you are seeing me today here, we will be supporting the House with the induction and capacity building. And then also the induction should be able to cover and ensure that all members will bring each other on board with the expectations as to how we are supposed to function, what are the expectations, and what are some of the key activities that we need to bring on board. I also want to bring to the members of the House that the work that should be done around the TB caucus is not the responsibility of health, as we have seen in most cases that sometimes it tends to only to lie in health. Hence, we end up, losing our focus. That it is not a health, it's not a health problem, but it is our problem. One of the issues of the action is to strengthening the oversight and accounting at our different structures at a community level. TB, bringing them forth, fighting to ensure that, TB allocations in terms of the budget, they are put forth. So all of us, we are going to be champions for TB, to fight against TB in our communities. If I have to add in terms of the commitments that we have made in South Africa of ending TB as a public health threat by 2030, I will want to bring to the attention of the members, and I hope the MEC for Health will be able to cover this, that members, TB is one of the diseases. Hence, I'm urging the House from the TB caucus that let's make it a priority. Today should not be viewed as the end of a process, but rather the beginning of a strengthened provincial movement against TB. The relaunch must now be followed by action, accountability, coordination, and measurable progress. If we work together with agency commitment and purpose, Mpumalanga can become a leading example of how provincial leadership can drive the TB response forward and contribute meaningful towards ending TB by 2030. Thank you very much.
Thank you very much for outlining the purpose. We'll continue with our program. The next item on the agenda is the message of commitment by the Mpumalanga Civil Society Forum Chairperson, Ms. Zonto Nkosi. A round of applause.
As my activist, ne, makuthule so. Uzithola unenkinga. Morning, greetings to Speaker, the Program Director, honorable members of the legislature, government representatives, civil society, developmental partners, distinguished guests, ladies and gentlemen. On behalf of civil society, community structure, advocates, healthcare workers, foot soldiers, and communities affected by tuberculosis, we would like to express our full support for the Mpumalanga relaunch of TB caucus. Today, relaunching is both timely and important. It demonstrates renewed political commitment and collective determination to strengthen the fight against tuberculosis in our province, in South Africa as a whole. Civil society remains critical partner in the national response to TB. I'm glad today we have DSD. With I don't see Department of Agriculture, which I think when we mention poverty, we really need to see the role DSD that has to play. TB treatment, it needs nutrition. Healthcare workers, traditional leaders, researchers, and affected population. Honorable MEC, most of the time we overlook, we nearly forget communities that are staying in farms. Those communities are more infected with TB. As civil society, we still commit supporting awareness and education, promoting treatment adherence, retention in care, working together with Department of Agriculture and DSD. As I've mentioned, TB treatment is not nice. We further encourage that the work of the caucus remains people-centered and community-driven. The experiences and the voices of TB survivors, healthcare workers, youth, women, mining communities, and rural population must continue to shape intervention and decision-making. Honorable Speaker, recently there is another population, the substance abusers, where also we need to take consideration as also their key populations. This relaunch of this caucus not only strengthening discussion, strong oversight, improved service delivery, and measurable impact in the communities. As civil society, we remain ready, Speaker, to walk the journey together. To strengthen prevention, improve access to care, support affected communities, contribute meaningful ending TB by 2030. Or public health remains the only government sector that is able to bring life to people. We therefore, as civil society, Honorable MEC, we are and we will advocate for NHI until it's been implemented. Together, let's build a stronger, united, and people response to tuberculosis. Tuberculosis is not in the boardrooms. Tuberculosis is outside there in the community. Let's all come together. Lente siyenzayo. Asinalo uvalo, ngishilo ngathi. But lente siyenzayo.
Ms. Judith Makubu. A round of applause. A round of applause.
Honorable Speaker, the Premier, which is the MEC of Health today in our midst, the members of the legislature, traditional and political leadership, colleagues from all spheres of government, civil society leadership, and partners in the fight against TB. I greet you this morning. It is a privilege to address you today as the Deputy Chairperson of Mpumalanga Provincial Private Sector Forum at this important relaunch of the Provincial TB Caucus Tuberculosis. Tuberculosis remains one of the most pressing public health challenges in our province. Mpumalanga contributes to carry a high TB burden closely linked to the factors such as HIV, co-infection, mobility linked to mining and agricultural sectors, and socio-economic vulnerabilities. In the private sector, in the private sector, especially in mining, manufacturing, construction, and agriculture, we see firsthand how TB impacts productively worker well-being and household livelihoods. From our engagements with the private healthcare providers, occupational health units, and workplace programs across the province, several patterns are clear. One, underdiagnosis and delayed detection still occur, particularly among mobile and contract workers who often move between provinces and districts in the province. Treatment interruption remain a concern, especially where workers lose employment or change workplaces. The issue of stigma, although reduced over time, continues to discourage early screening and disclosure in some work environment. Yet, honorable members, there is also meaningful progress driven by collaboration between the private sector and the Department of Health. Allow me to highlight a few success stories from within the Mpumalanga private sector, one in the mining sector. Mining companies in Emalahleni and across the Nkangala region and Sibande districts have successfully implemented routine on-site TB screening and digital chest X-ray services, leading to earlier detection and a significant increase in case finding among employees. These interventions have reduced advanced TB presentations and improved return to work outcomes. A commercial forestry company in the Sibande district partnered with the local clinics to integrate mobile TB and HIV testing services for seasonal workers. This initiative not only improved access but ensured that workers who tested positive were immediately linked to care regardless of their employment status. In the agricultural sector, a group of commercial farms collaborated with the NGOs and the Department of Health to train peer educators who support TB treatment adherence. This program has continued to improve treatment completion rates and reduce defaulting. Several private general practitioner networks in the province have strengthened public-private referral system, ensuring that patients diagnosed in the private facilities are similarly linked to the public sector for free treatment and follow-up. This has improved continually of care and reduced loss of follow-up. These examples demonstrate that when the private sector is mobilized, aligned, and supported, it becomes a powerful force in the TB response. The private sector in Mpumalanga, working closely with the Department of Health, is actively contributing to TB control, though workplace screening programs include TB symptom screening and leakage to diagnosis services such as GeneXpect testing. Integrated TB and HIV services, particularly in mining and large industrial operations, where co-infection is addressed holistically. Data sharing and surveillance support, with several private providers contributing to case notification system to strengthen the provincial TB response. Treatment support initiatives, including workplace adherence programs, peer educators, and collaboration with community health workers to improve the outcomes. Public-private partnerships, where private facilities refers patients into public system for continuity of care and drug supply, ensuring no one falls through the cracks. Honorable Speaker, despite these efforts, gaps remains. Honorable members, the relaunch of this TB caucus comes at a critical time. It offers opportunity to reinvigorate multi-level accountability and coordination. As the private sector, we reaffirm our commitment to support provincial targets to find, treat, and prevent TB. Share data and insight transparently, investing in workplace healthcare programs, align fully with National Strategic Plan on HIV, TB, and STIs. We believe that ending TB in Mpumalanga is possible, but only through sustained collaboration between government, businesses, labor, and communities. Let us use the caucus not only as a platform to dialogue, but as a driver of measurable action and impact. Together, we can accelerate progress, close gaps, and ensure that no person in Mpumalanga is left behind in fight against TB. I thank you.
Thank you very much for the commitment, Private Sector Forum. Then we'll now continue with our program, which is the message of support from the Chairperson of the Committee of Health, Honorable Mhlongo. A round of applause.
Program Director, Honorable Speaker, representatives of government and civil society, healthcare professionals, our distinguished guests, ladies and gentlemen. It is both an honor and privilege to extend our heartfelt support on the launch of the Mpumalanga TB Caucus, a significant milestone in our collective to fight against TB in South Africa. TB remains one of the most pressing public health challenges facing our country and our continent. Despite the progress made over the years, far too many families continue to suffer the devastating social and economic consequences of this preventable and treatable disease. The burden of TB, especially when compounded by HIV and poverty, demands stronger collaboration, accountability, and community-driven action. The establishment of the Mpumalanga TB Caucus demonstrates commendable leadership and commitment towards strengthening advocacy, oversight, policy coordination in the province. This platform has the potential to mobilize political will, amplify the voices of affected communities, and ensure that TB remains high on the public health agenda. As the Portfolio Committee on Health, we recognize that ending TB requires more than medical intervention alone. It requires partnership across all sectors of society, investment in healthcare systems, reduction of stigma, improved access to early diagnosis and treatment, and a people-centered. I wish the Mpumalanga TB Caucus a success on its important work. Build a healthier nation for future generations. I thank you, Program Director.
Thank you, Chairperson of the Portfolio Committee on Health.
Representative from the Department of Health, healthcare professional, community health workers and social partners, Chairperson of the civil society organization in the province, and the private sector in our midst, and the representative from the SANEC, distinguished guests, ladies and gentlemen, and honorable members of the provincial legislature. I bring you warm greetings on behalf of the Premier of the Mpumalanga province, Honorable Mandla Ndlovu, our province and the country at large. Today's engagement is not simply a health program. As most of the speakers have already indicated, it is a call for collective action. It is a reminder that the fight against tuberculosis requires united leadership, coordinated government intervention, community mobilization, and active citizen participation. Program Director, allow me at the very beginning to also recognize that today coincides with International Nurses Day, a day in which we honor the dedication, sacrifice, compassion, and professionalism of nurses across Mpumalanga, South Africa, and the world. Nurses remain the backbone of our healthcare system. They are often the first point of contact for patients and communities. They work under difficult conditions, spend long hours caring for the sick, confronting families, and ensuring that healthcare services continue to reach our people. In the fight against tuberculosis, nurses continue to play a critical role in screening, diagnosis, treatment, support, patient education, tracing, and community healthcare intervention. Their contribution is ensuring treatment adherence and improving patient outcome cannot be overstated. As government, we salute all nurses for their selfless services and unwavering commitment to saving lives and restoring hope in our communities. We further acknowledge the continued support of the Premier through the Mpumalanga AIDS Council and provincial intervention aimed at strengthening the fight against TB and HIV and AIDS across communities. Program Director, the presentation before us clearly demonstrates both the progress we have made as a province and the urgent work that still lies ahead. Tuberculosis remains one of the leading causes of death in South Africa and continues to disproportionately affect poor and vulnerable communities. While our country has made progress in reducing TB incident, mortality remains unacceptably high. According to the presentation, South Africa recorded approximately 270 incident TB cases in 2023, which more than half occurring amongst people living with HIV. This reality reminds us that TB cannot be separated from the broader social and economic condition facing our people. TB is not only a medical condition, it is also a socio-economic disease. It thrives in overcrowded communities, informal settlement, mining communities, correctional facilities, and poor ventilated spaces. It affects communities burdened by poverty, unemployment, malnutrition, and inequality. It also disproportionately affects working age adults between 25 and 55 years, the productive population of our economy. This means that TB directly affects families, workplaces, economic productivity, and the broader developmental aspirations of our province and country. As government, we remain guided by our Vision 30 and National Development Plan, the National Strategic Plan for HIV, TB, and STI, and the commitment to universal health coverage through national health insurance. The government also advocate for inclusive economic growth, job creation, reduction poverty, and cost of living, building a capable and developmental state, improving healthcare access and quality, investing in people and communities, and strengthening accountability and service delivery. The fight against TB forms part of those broader national priorities because healthy communities are central to social and economic development. As Mpumalanga Provincial Government, we remain fully committed to strengthening the public health system, improving healthcare services and access, advancing preventative healthcare, and ensuring that communities receive quality and dignified healthcare service. The presentation highlights encouraging progress made by the province in combating TB. Mpumalanga diagnosed more than 11,400 TB patients during 2024, including both drug-susceptible and drug-resistant TB cases. The province continues to intensify screening and investigation through healthcare facilities and community outreach programs. Today, Honorable Speaker, I must indicate that honorable members here, I was happy when the program delayed with an hour because as a Department of Health, we provided screening outside there. And I made sure that each and every one of them, they screen. Honorable members. But also, Honorable Speaker, what I've noted and I've told honorable members, it was very difficult for me to make sure that, especially the men, honorable members, to go and screen. And I was saying to them, you'll be coming here on stage and saying, honorable members, you don't reach your target. It was difficult. I started around 8:30 up until we extended time to around 9:45 to make sure that all of them, they go and screen. But I can confirm that, Honorable Speaker, they all have tested and they all have screened today. So the province will continue in terms of investigation through healthcare facilities and community outreach programs. We are encouraged by the implementation of a newer diagnostic technologies, including digital chest X-ray, urine testing for TB, stool testing for TB in children, expanded community screening initiative, and targeted universal testing for TB strategy implementation. These interventions are important because they improve early detection and reduce delayed diagnosis, which often contribute to severe illness and unnecessary death. As some have already indicated, there's nothing that is so painful for us as a Department of Health to record even one death. When you can go to a clinic where you're staying and test if we have got TB, you can be treated there. So this program, we appreciate that now together we'll be able to make sure that we deal with awareness campaign in the constituency offices where these honorable members are part of. We also welcome the implementation of the targeted universal testing for TB, which prioritizes vulnerable groups such as people living with HIV, newly diagnosed HIV positive patient, pregnant women living with HIV, close contacts of TB patients, and people previously treated for TB. We've seen the minister, together with him, we launched a program last year where we are saying that we want to test more than as many people as possible in the country, and this is a program that we are busy with. This demonstrates a preventative and proactive healthcare approach, which is central to strengthening public health outcomes. Program Director will also commend healthcare workers and district teams for improvement in treatment outcome. The provincial TB treatment success rate currently stands at 77.2%, with some district and municipality showing commendable progress. We particularly acknowledge municipalities and sub-districts that continue to perform well and exceed target, including Nkomazi Mkhondo, Dipaliseng Likwa, and Dr. Jez Morok. This success must be studied, consolidated, and replicated across the province. We are further encouraged by the reduction in loss to follow-up cases. Provincial loss to follow-up rate have improved from 5.2%, which is within the national target, or below 6%. So as a province, we are 5.2% below the 6% national. This reflects the dedication of healthcare workers, community healthcare workers, tracing teams, outreach teams, and program managers, civil society, and the municipality who continue to ensure that patients remain on treatment. The work of ward-based outreach teams, community healthcare workers remains critically important in ensuring continuity of care, medicine delivery, tracing of patients, and health education at household level. Program Director, one of the most remarkable achievements highlighted in the presentation is the progress made in drug-resistant TB management. The province has seen significant improvement in the DRTB treatment outcome following the introduction of shorter all-oral treatment regimens. Treatment success rate improved from 55.2% in 2026 in the province of Mpumalanga to more than 80% in 2024. There has also been reduction in treatment default, reduction in mortality, elimination of injectable treatment associated with hearing loss, improved patient adherence, and treatment completion. These improvements demonstrate the importance of innovation, scientific advance, and patient-centered healthcare intervention. Program Director, while we acknowledge progress, we must also honestly confront the challenges before us. The presented above is that there are several critical community-related challenges that continue to undermine our effort, including delayed health-seeking behavior, treatment interruptions, stigma associated with TB. People are afraid to test TB because they think if you have got TB, you are HIV positive. And even if you are HIV positive, there's nothing wrong because we can also give you medication for HIV positive. So that stigma of TB and HIV is something that we must deal with. Inaccurate physical addresses. I was monitoring honorable members whether they are putting their correct names and address, because we can have one person registered in our system. Namhla uSasekane, tomorrow Janet, Ngomso, Badban, even address, making it very difficult for us to even trace the people or even the numbers. We might think we've got 10 people that we're tracing, only to find that is one person that has been registering everywhere, but the person doesn't want to be known. So honorable members were honest based on their oath. I've seen their names there, they were written